This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. We interrupt our regular programming today to bring you a special report, an update on the spread of COVID-19 and the fight against COVID-19 in Erie County. This is the county executive's first briefing since Tuesday. We want to go live now to the studios of WQLN television. Here is Erie County Executive Kathy Dahlkemper.
Good afternoon, and thank you for joining me today. Today I want to give you an update on the COVID-19 pandemic here in Erie County. We have 11 new positive cases to report today. As our cases continue to increase, our contact tracers are busier than ever. Their priority is doing their investigations. Having said that, next week we will move to one briefing only on Wednesday at 10 a.m. and that will continue on weekly unless we feel that there needs to be changes in that. But we will continue to communicate with you through press releases to the press, and again with a press briefing when it's deemed necessary. We're also changing the way that we're reporting where people reside next week. We've decided to move from the cumulative cases map, which we began before the state started providing the zip code map, and we'll provide the link to the state's zip code map on our website. So that will take you directly to the number of cases per zip code in Erie County. So thank you for your understanding, for your patience, and for your flexibility as we try to free up some of our staff's time to do the hard work ahead and still give you the information that you need. We now have a total cumulative of 253 positives, 4,776 negatives. And the state is reporting 70,735 total cases of COVID-19 with 5,464 deaths and showing 65% recovered across the state. Crawford County has 30 cases. McKean still reporting 12 cases and 1 death. And Venango County has 8 cases, Warren with 3 cases. Trust me when I say that I understand that everyone feels very strongly about Erie County not being on the list of counties going to green next Friday, and I do too. Unfortunately, our cases in Erie County continue to rise and have consistently risen in the past few weeks. And for this reason, the state informed me earlier today that they determined that we were not ready to go green. I, however, do feel that Erie County is ready. I do respect the authorities making these decisions, and I understand that it's up to every one of us, as I've said all along, to make this happen, the going to green. We all, as a community, must make a sacrifice right now. It's time to think about others. This is not about me, and this is not about you. This is about all of us as community, and what it means to love and respect our neighbors and our community. Because, you know, love is not possible without sacrifice, and sacrifice is not possible without love. And so often we say that we love our country, and we do. We say we love our community, and we do. We love our friends, our neighbors, and our family. But are each one of us willing to sacrifice for the places and for the people we love? And I am asking you to sacrifice now to prove your love, to show it, to prove your love for this country, for this community, for your neighbors, for your friends, for your family. And there's one thing you can do to show your love, and it's wear this. This little, maybe 1 ounce piece of fabric is the way that you can sacrifice and you can show your love that you say you have. Because there are people in our community who need us right now to show the love and the sacrifice that even wearing a little simple piece of cloth, a mask over our face and nose, can show. Let us collectively show our love for our community and all of those who live in it. We can then truly say that we love our country, and we can truly say that we love our community. We can truly say that we love our neighbor and our family and our friends. and we are willing to sacrifice to prove it. As we look forward to that day when we go green, hopefully very soon, we know there are preparations in our restaurants and our food service facilities that need to be made prior to that time. So the Erie County Department of Health has been working with City Grows, a local company who's developed 2 forms to help our licensed facilities create their COVID-19 prevention plans. And this is encouraged by the governor's guidance for businesses in the restaurant industry. The first form is a tool for restaurants, grocery stores, and food facilities to use as they develop their own plan. This tool is available for any licensed food establishment and may be reviewed by the department prior to opening, during their regular inspections, or as a response to a complaint. Since each facility has specific needs and requirements, the Erie County Department of Health has taken the time to put the requirements forward so that these food facilities are able to think about each part of their business as we aim to move into the green phase. The second form is for the seasonal closure due to COVID-19. So if any licensed facility is not going to be open and operating this summer, such as a campground, a public swimming pool, a restaurant, their license will be held through this form. That means that there will be no license fee or late fee from the Erie County Department of Health. This will not be due until 2021 if the business is not operating. But you must complete the form to receive the changes in your fee schedule. We encourage our restaurants, our bars, our grocery stores, and other licensed facilities to take advantage of this newly developed tool. The more prepared we can be as a community to go to green, the smoother that transition will be, and for each one of us. Both forms can be found at eriecountypa.gov under the COVID-19 Business Resource page. Speaking of businesses, I want to continue to note those Gold Star businesses to recognize today. The Health Department indicates that Boscov's department store in the Mill Creek Mall is maintaining a very clean location to protect its workers and its shoppers. They have someone wiping down every cart after each use. And we hear also that the environmental team, from the environmental team, that the Delta Sonic is also doing a fantastic job. Every employee wearing a mask, signs stating that all customers must wear masks upon entering, and they're recommending that guests pay with a credit card versus cash to reduce the contact between employee and customer. As well as they have installed those plexiglass barriers we're becoming more familiar with on their counters for your checkout area and at their post office. In addition, Delta Sonic has marked their floors to encourage that 6-foot distancing. Lastly, they have an employee outside with a spray bottle of sanitizer and a towel, and that person keeps an eye on the gas pumps and sanitizes them after each use. So this is really a phenomenal effort and shows that they truly care about their customers and their employees. So thank you to every business who's doing everything they can to show their love for Erie County and keeping Erie County residents safe while they have reopened. And speaking of reopening, the Erie County government will reopen to the public Monday, June 1st. And so here to tell us more about what that is going to look like is Gary Lee, my Director of Administration for Erie County. Gary?
Thank you, County Executive. Reopening of the courthouse will be on Monday, June 1st from 8 a.m. to 4:30. That's the normal business hours. The key goal of the administration is to ensure the courthouse is a safe and healthy environment for all. County government will be following new procedures and policies. 1, universal masking policy. We are requiring each and every one entering the courthouse have a mask on. 2, adhering to social distancing guidelines, which are 6 feet apart. 3, we have installed several hand sanitizer stations throughout the courthouse, and we would like for you to use them frequently. And then 4, we're going to ensure that all the common areas are clean and clean frequently. So as you enter the courthouse, the sheriff's deputies will be asked in a series of questions. 1, are you experiencing an abnormal cough, a shortness of breath, loss of taste or smell, a sore throat. Please be patient with the deputies because they're only trying to ensure your health and the health for the employees here at the courthouse. As you proceed into the courthouse and go about your business, there will be floor markings to ensure that you're keeping the proper safe distancing. Please adhere to these floor markings. As you enter to the various offices, you will notice that there will be laminated glass between you and the employee. That shield will help to the droplets that may be coming out while speaking. The hand sanitizers, as I mentioned earlier, we want to encourage you to continue to use those throughout the courthouse. And then the court administration. We have worked very closely with the President Judge Trisella and his team to ensure that the proper spacing and the courtrooms are cleaned properly. They will be operating under a reduced schedule in the coming weeks. They will continue to utilize technology, whether it's visual technology, visual hearings, or whether it is teleconferencing when deemed appropriately. All jury trials for the month of June have been postponed. We encourage you to continue to utilize our website. You know, over the last couple of months, technology has become our friend. So make sure that the business that you have been able to transact through the internet, please continue to do so. Mailing, continue to use the U.S. Post Office. And of course, if you're using drop-off and pickup services, continue to use that. We want to ensure that the courthouse is safe for all so that we can have that tomorrow that we're dreaming of. Thank you, County Executive.
Thank you, Gary, and I want to thank you. I want to thank all the elected officials and all the directors of the different departments who've really been working closely to make sure when county government opens back up, we do it as safe as we can for our employees and for all of those who depend on county government for a myriad of services. So thank you, Gary, for really working hard and leading that effort. And now I'm going to open up for questions, and we'll start today with Jet TV.
Kathy, it's Sean Lafferty today. I know you started by saying that the state said that we aren't ready to go green. You feel strongly about that. You think we are ready to go green. However, we're being told that at some point, someone at the state level asked us, county government, if we thought we were ready to go green, and the health department said no. True or false?
So I have been have had numerous conversations with state officials since yesterday, even obviously before that, and have indicated through my research and everything I've done that I believe we're ready to go to green. And I've spoke to our hospitals to make sure that they felt comfortable with that. They have agreed with me. I've talked to the state legislators who have also believe that we are ready to go green. I know the health department's biggest concern is the volume of the cases that they have seen and the workload to the people that work there. And I understand that. Just to give you an example, we have one employee who has worked every single day since the first case, sometimes often working 70 hours a week. We have many other employees putting in extremely long hours. We have set a very high standard at the County Department of Health. That high standard is what has kept us with lower numbers than most places and a death rate that is very low compared to any other counties with a death even that has occurred in it. So with that being said, I can assure you that I have done everything I can in the last couple days to encourage the state to move us to green.
Just a follow-up question, if I could, please, Kathy. With Allegheny County being included in the list that's going green now, you know, by what metric can the city of Pittsburgh be more ready than Erie County? And I guess, you know, is that at the root of your frustration?
So I don't know about the city particularly. I know about the county of Allegheny County. This is all being pretty much done on a county level. And I had talked a little bit earlier today to Rich Fitzgerald from Allegheny County, and he said he was surprised, but actually after they went to yellow, their cases actually leveled off and have even declined in terms of the number of cases, where ours, as you know, have basically, and this is what I was told by the State Department of Health, because I had a conversation with them earlier today too, and they said, having seen our cases, basically what they indicated quadrupling, they are concerned about the trend, and so they're looking at the trends of where the counties are going, and our trend is something that they said concerns them greatly. They also talked about having robust contact tracers, and of course I think we've talked a lot about contact tracers over the past months, and you've heard a lot about what we are doing in Erie County, and we have a very high standard again, and that's what's kept people either quarantined or isolated so that we can keep people out of the community who may potentially spread COVID-19. And so I said to the state, you know, if you have extra contact tracers, if that's one of the things you're looking at, and you have more ability for us to have a more robust contact tracing here right now than we currently have, we're trying to get to that point, but we don't have it yet, then why don't you deploy some resources to Erie County so that we can actually get ahead of this in a way maybe we haven't had to, and my employees wouldn't have to work up to 70 hours a week and work every single day for 3 months. So that is what I've asked the state for at this point, since they said that that's an issue. Thank you. Erie News Now.
Good afternoon. Just wanted a clarification there. So you can tell me that to the best of your knowledge, no one on the county government level has told the state that we're not ready for green.
I am not saying that. I'm saying there's conversations, various conversations. I'm saying from my administration, I have been pushing for green. But there have been conversations with the Department of Health. It's more about our metrics, our data, you know, what has happened there, and what the opinion might be about our trends.
So then, to your knowledge, did the health department say we're not ready?
They have indicated to many of us that they are concerned. And again, I'm going to go back to the employees. Their big concern is that we have seen these cases continue to rise, and we don't have the staff. Currently, we're trying to find funding for that staff. We've been working on that. We're trying to get people hired and in and trained up, and there is a huge concern that we don't have the staff that we need to mitigate the spread of this disease in our county. And we also, and this goes on the public, we have seen many, many cases of people completely ignoring the pleas, the requests to wear masks and stay 6-foot distance and to not have gatherings of more than 10 people, and yet over and over again we continue to hear of incidences where those things have happened. And so we can only do so much from the county health department side. We can't do it without the public, and we need the public to be better cooperators in this and to be our partners, and it just hasn't happened, and it's frustrating. It's frustrating. Talk Erie.
So just so I have this totally square and accurate here, you think we're ready, the health department says not so fast.
The health department looks at things completely 100% through a public health lens, and their professional opinion may differ with mine, and that I look at things through a larger lens of the entire community, not just public health, which is obviously a big part of this right now, because COVID-19 is a public health issue. I look through it also from the mental, the fiscal, all those other things that we look at as a community in terms of the health of a community. And so if I'm just looking through it from one lens, and we all have that in our lives, we look at things through our lens, we see things sometimes differently than others do. Talk Erie.
Thanks.
Mm-hmm.
Yes, hi Kathy, it's Joel Natale. I do want to ask the why question. Why have there been so many more cases in the last 2 weeks? We've had 61 in the past week, 62, right around there the last 2 weeks, 123 cases. What's the reasoning? Is there community spread? Is this clusters of people that are infecting each other? Can you explain?
It's community spread. And this is one of the things we talked about with the Department of Health today. You know, as they looked at our numbers and they were looking at the trends, and they wanted to see, does this have to do with the hot spot? Does it have to do with family clusters? Does it have to do with a cluster in a business or a nursing home or any place like that? And they could not find any of those things. What they saw was community spread. And this goes back to people, again, just acting like COVID-19 has gone away. Acting like it's not a big deal. In some ways, I think we did too good of a job in controlling it, where people think it's not a threat anymore to our community. And it is, and it's spreading. And it's spreading in Erie pretty good right now. And so if people don't wear their mask and they don't keep 6-foot distance and they go into crowds more than 10 people and they don't wash their hands and they don't keep their hands off their face until they wash them, we're going to see more of this. So I don't know how, I don't know why my message doesn't continue to get out there, but I know we're all weary of this, but it's here until we have a vaccine. We haven't gotten the testing that we had all expected to get. Massive testing throughout the United States. They're working on a vaccine, but all of these things are part of it. But in the meantime, we don't have many tools, and I just named what they are.
You're fading away, but I do want to ask a follow-up question. The St. Vincent system reporting 2 people with COVID in their hospital this week. Obviously, we have tremendous capacity. Doesn't that go to this concept of being ready or not, of just the mildness of the actual infection so that there's very few hospitalizations?
Well, that is what I argue to the state, because I look at those numbers too. And I've talked to the heads of the hospitals, of our 2 major hospitals, in the last 24 hours, just to get their understanding of what's going on, you know, just to get their, knowledge of what's going on, and are they ready, and, you know, do they have the capacity? And so I did my homework. I did my, looking at this from multiple angles, and I did talk to the State Department of Health about that. But they kept going back to our numbers quadrupling, and the contact tracers, that, you know, you need to have enough robust contact tracers in place. And that's when, again, I said, send us some. If you've got them in the state and you're not being used, send them to Erie County. Let them help us out till we can get ours up and trained.
Thank you.
Sure. Erie Times News.
Yeah, Kathy, you've discussed it a bit. Can you talk at all any more about what all criteria the state was looking at when they made this decision, and what criteria you're looking at that leads you to disagree with the state and your own health department on this?
State told me they had 2 things they were looking at. One was the robust contact tracing, and number 2 was the case trends. So those are the 2 criteria, which I've pretty much already discussed. When I asked about some of these other things that I was looking at, like hospital availability, also just looking at the economy of the community, looking at basically, I think the strength, one of the strengths we've had up here is our environmental team, who's been working all along with our businesses, and what we're not finding that this COVID-19 is spreading through any business. It's not. It's being spread out in the community, at people's parties, at people's homes, in people's neighborhoods, people getting together to do whatever activity they do. That's where it's spreading. So I give kudos to the businesses in our community, and I give high kudos to my environmental staff who have worked so diligently and so, I think, skilled with all of our businesses. So it really is out there in the regular community. That's where it's being spread. And so I've looked at all those different parameters, and I don't know that I can change people's behavior at this point. People have to change their own behavior. And so with all of that, and looking at the economy of our community, and looking at people who don't have jobs and can't pay their bills and can't get groceries and can't pay their rent, and on, you know, we've got to get people back to work. And hopefully when they get back to work, maybe they'll actually be safer, because maybe their business will require them to wear a mask and keep everybody socially distanced. I can only hope. All right, Jet TV.
Kathy, back when we were getting set to go to yellow, You said you unfortunately expected higher numbers of cases. Can you describe your expectations at that time versus what has actually happened?
Well, I don't know that it's any different than what I had expected. We had just done so well when we were under the red phase and under the stay-at-home order. Our community really stepped up to the plate, and my health department really stepped up to the plate, and it was working. And so we knew when we went to yellow that there would be people, even though we gave them the guidance, who would just ignore that guidance and think, okay, stay-at-home order is over, and we could go back to life as we knew it prior to COVID. And as much as I've said we cannot, and we cannot until we have a vaccine, and other people have said the same thing. It's not just Kathy Dahlkemper saying this. It's Dr. Fauci and Dr. Birx on the federal level, and it's Dr. Levine and Governor Wolf on the state level, and it's myself and many others, professionals here on the local level. We're all saying this, but people just aren't. People aren't listening, and they aren't believing, and they're doing whatever they want.
Just a quick follow-up, if I could. With how well we apparently did to get to yellow, to what extent do you believe as a community that we just simply blew it when it came to being ready for green, or to convincing the state, if you will?
Well, that's an interesting choice of terms. We blew it. You know, I really had hoped and thought we would get there. I thought we'd be one of the first counties to go to green. Because we have a health department, because we were doing so well. But I don't think the community helped us in this respect, and that's unfortunate. And I tell people all the time, if you're worried about the economy of this community, if you really want to make a difference and help us go forward, put your mask on, keep yourself 6 feet distance from other people, stay away from crowds. You know, that's the kind of thing we need people to do. It's a sacrifice. I know it is. But it's a simple sacrifice. It's not a hard sacrifice. It's not any kind of sacrifice as we have asked others for decades in our country to do. But we need people to do this little sacrifice for our community, and it's not happening. Erie News Now.
Hi. What is your message to business owners who are watching people now, not even just Crawford and Warren counties, but all over the state reopen, and they're just still stuck in limbo?
I'm sorry. I'm sorry for them. I'm sorry that we weren't able to get to green. That's what I say, because I truly am sorry. And their customers are going other places. People from Erie County are traveling to other counties to get that same service, whatever it is. And now they're going to be able to go to even Allegheny County. They're going to be able to go other places to get these services, and I am truly sorry. And I'm fighting for you, and I'll continue to fight for you. There is one good piece of good news. The state, as we might know, passed legislation in the budget last night, and we are expected to get over $24 million into Erie County to help with the fight against COVID, but also to help with the economy. And so as we get more details on that, we will be looking at how we can help our businesses most affected by this and help them so that they can survive and open and be a strong business as we go forward. Talk Erie?
Yes, ma'am. I want to ask about the recovery rate. On your website, it's showing 175 recovered, only 63 active cases. And so really, it is a very, very tiny number of the population of Erie County that even has COVID right now. How do you react that we would be in the same phase, the yellow phase, as Montgomery County or Delaware County? It seems to be remarkable considering what the data actually shows.
I agree with you, Joel. I think we should have gone to green. I'm not the only one. There's a number of others, elected officials, who also believe that. I know this disease is here, and I know it's spreading, and I know it could result in people going into the hospital and some people dying. I know that. These are really tough decisions to make as elected officials. These are life and death decisions. This is not easy stuff. But But I also know that there's a lot of other hurt going on in our community that also needs to be addressed. So I'm as maybe surprised and shocked and somewhat angry today as many other people are. Erie Times News.
Thank you.
And I'm sorry, Kathy, just so you know, it is a little tough to hear you. I don't know if anyone else is having that experience, but I hope you can hear me okay.
I can hear you fine. Is that any better? I'll put the mic a little closer to me. Is that better?
Yeah, it's fading in and out. I think that's better, but it might be a transmission issue. I'm not sure. Anyway, thank you. I just wanted to ask, I understand that not all of these decisions were on your plate. A lot of these decisions were made at the state level, but do you think that given what we're seeing now, is it possible that Erie County moved too early to shut down, and now we're sort of seeing the curve happening after we began reopening, if that makes sense?
I don't think that's the case at all, honestly. If we hadn't shut down when we would, our numbers would have been much higher, but maybe that would have made people more serious about it. But we kept a lot of people alive, I believe, and kept a lot of people from getting very sick. We also gave our healthcare system the time that they needed to be ready for any surge that might possibly happen, either here, either now, either this past few months, either now, or remember, COVID's not going away. So fall is expected to be worse. So we gave the healthcare systems the time that they needed, and I've been told by one of those leaders, you know, we've learned a lot in these few months, and that it's knowledge that was really necessary for us to be ready. So that's important to remember also.
Do you think, given that how all of this has gone, particularly in Erie County, do you think that state and county government have maintained adequate credibility to make calls like this in the fall if there is a resurgence? Like if we need to go back into the red zone, say, if we're still using that metric in the fall, do you think the Erie County government and the state government have the credibility at this point to make those calls and have people trust and listen to them?
I think our county government has done a phenomenal job. In fact, I would put us up against any other county government in the entire Commonwealth. We have been, honestly, like the gold standard in terms of what you do in a pandemic. So yes, I think we have gained a lot of credibility. People may not always be happy with our decisions. People may not always agree, but we'll see. I mean, history obviously will tell, right? We will look back on this. It'll be looked at. It'll be studied. And are there no mistakes made? I can't say that, because some of this stuff you're not going to know until the future, right? As to what was done really well and what could have been done better and what we didn't do well. And all of that will flush out in time, but I can tell you we have worked hard to make the best decisions with the data in front of us and the advice of experts throughout this entire time, and I think the public knows that.
Thank you very much.
Sure. Jet TV, last question.
Yeah, Kathy, just looking to firm up the number of deaths. I know that there had been a discrepancy between the county and the state for a little while, the county reporting 3, the state reporting 4. Have you come to a firm number yet?
We still know of 3. There's 4 on the website. My team is way too busy to dig into that. We're taking care of the living right now, and so eventually that'll all get worked out between the state and us and the numbers and the details, but our only guess, I guess, and it's a guess, is that someone died elsewhere who has their permanent address in Erie County, because we can't figure out who that person is. But they could have died in another community, and you have to remember that the death records that the coroners keep and the death records that we keep through this NED system, they actually don't talk to each other. So, but again, everybody's so busy taking care of the living that the death isn't really something that we're investigating at this particular time to try to clear that up. Erie News Now, any final question?
I do have, please. Is it accurate to say that at this stage of the game, Erie County's in the worst position it's been, both in terms of cases continuing to rise and in terms of businesses being shut down while other areas of the state reopen? Are we at our low point right now, at least so far?
We certainly are at our worst position we have been with cases. I will definitely say that. And when you look over the 14 days, we've had just an enormous volume to have to deal with. In terms of our businesses closed down, I mean, of course, we have businesses that have reopened in the yellow phase. So I don't know if we're at the worst with that because, you know, we had a number of businesses that were open, and once we got to yellow and able to kind of get back to work. So it's hard for me to say on that piece.
Do you continue to, or plan to continue to push us to get to green, to push the state to put us in green? And if so, take me through those plans.
Well, my plan is to continue to talk with all of those who can help me make these decisions and what might be our other alternatives, and also to continue to reach out to the state, to the governor, to have them better understand what my thinking is and so the parameters we've been looking at, and then to continue to watch our numbers. And, you know, I'm hoping a week from today we're on the list, because it seems like Fridays are the days for the state to announce who goes to a different phase, and I certainly hope that next Friday we're on that. But with that being said, I implore the community to help us on this, to wear your mask, to stay 6 feet apart, to not be in any group larger than 10, keep your social distancing and your mask on when you're with any group, and to wash your hands frequently and keep your hands away from your face, and all those other things that I've been saying for 3 months now. Talk, Erie, do you have any final questions?
No, ma'am, thank you.
And Erie Times News, you have the final question if you have one.
Yes, briefly, Kathy. Did you get a sense from the state about a number of contact tracers that they would like to see, and also what they would like to see in terms of our numbers? Would they want our numbers to be flat for us to proceed to the green phase?
So one of the frustrations for me was I asked them, what is the goal here? What are we trying to reach to go into the green phase? You know, what is that metric? And I was not given those metrics by the state.
Okay, understood. Right. Thank you.
Thank you. Well, thank you all. And so in closing today, on a different subject a little bit, but I'd like to share 2 initiatives called Feel Your Feelings Friday. I don't know if that's a good one for me today or not, but Erie Arts and Culture has created this to promote mental wellness in Northwest Pennsylvania. So maybe it is good for me today to express my feelings. But as you know, a lot is happening around the nation, world, and right here in Erie County. So this initiative, I think, is great, actually. It intends to engage both our youth and adults in a visual, performing, and literary arts to navigate our feelings, which we all know can be very strong, and express our emotions, which sometimes we're all struggling to deal with. So Erie Arts and Culture is asking young people of Erie County this specific question: how are you feeling? And the youth can use any artistic discipline, medium, or material to respond to that. All Erie County students in grades K through 12 are welcome to participate, and you would mail your submission to programs at erieartsandculture.org by Monday, June 15th, so you have a couple weeks to do this, and it would be a really good thing to do, I think. The second initiative is a journaling project for adults. Give rise to your feelings. Writing prompts will be posted on social media daily, and journal entries can be submitted to the agency by commenting or tagging Erie Arts and Culture on Facebook or Instagram, or by emailing photos of the journal entries to Kristen, Kristen M, Kristen M, at erieartsandculture.org. Erie Arts and Culture has about 150 journals available if you don't have one, a way for you to journal at home, so you can find that also on their website. And honestly, the arts is a great healer, and so thank you to Erie Arts and Culture for really just trying to be part of the healing process as we continue to struggle through this pandemic. And the last thing I want to mention is the election is next Tuesday, the primary election, and if you asked for a mail-in ballot, and 34,515 of you did, only 19,082 have been received thus far. You have until 8 p.m. on Tuesday night to do that. It has to be at the courthouse. So if you're going to mail it in, you probably should get it mailed out today. If you're going to drop it off, there is a great box outside right by the front door that County Council was able to secure, and you can drop your ballot in that box. So please remember to vote. It's really important to our future that you get out there and have your voice heard. So with all that being said, there's a lot for all of us to digest today, but I ask you all, please do everything you can to not only stay close to home, but to continue to do all of the guidelines that we've asked you to do. And we ask you, by doing that, you'll stay safer, and then all of us, we need to just stay calm too. Thank you.